In this case report, we examine the impact of shockwave therapy or low intensity extracorporeal shockwave therapy. I'll just call it shockwave on a patient who had 20 plus years of residual episiotomy, scar pain, and hip dysfunction, SI joint pain, and overall dyspareunia after two vaginal deliveries. So she had been doing physical therapy and strength training, but came to our office after experiencing dyspareunia and pain on just a daily basis. So she received 10 shockwave therapy sessions over the course of 6 months, targeting the pelvic floor, that episiotomy scar tissue, and then her lumbar spine, SI joint, and hips. She also received 3 pelvic floor Botox injections over that course of the 6 months and continued with her pelvic floor physical therapy. So after each appointment, we interviewed the patient, of course, and she ended up reporting a vast improvement in her chronic pain and tension, and found that overall her pain score, her quality of life was just improved tremendously. So while it was not a perfect case, she received more than just shockwave. She also got the pelvic floor therapy. We do have some evidence to suggest that the shockwave was part of her reduction in her pain. She reported globally that she would have liked to come in weekly for 10 weeks, and unfortunately distance did not able her to do that, so she had to kind of chunk her therapies over a few months at a time. But overall, I think this case report kind of opened the door into discussing shockwave in a postpartum population. That's a great question. And I think I first want to say that shockwave therapy would be, just a tool in the toolbox for pain and healing. That's the most important thing. And we can think about it in a couple of different ways. But before I sort of dive into answering your question, I do just want to mention that last year in 2025, the AUA, the American Urologic Association, released their expert guidelines on treating male chronic pelvic pain and chronic prostatitis. And they found that treatment with shockwave was a moderate grade A recommendation, which means that the benefits outweigh the risks and that they can apply this recommendation in a majority of their patients. They're unlikely to change that recommendation. So, if we can be certain about it working in male chronic pain, I think it's worthwhile examining in our female population. But, back to your question, I think that shockwave therapy would most appropriately fit in as a second line therapy after failed conservative management, particularly, I think that pelvic floor physical therapy. So when we look at the expert guidelines from ACOG about postpartum pain, they recommend starting with NSAIDs or acetaminophen and then going to topical agents and then going to physical therapy. So that pelvic floor therapy is kind of that conservative first line approach. But, shockwave has demonstrated safety and efficacy. There's been multiple systematic reviews, and so we think it would logically fit in that, maybe after 8 weeks or 12 weeks of failed pelvic floor physical therapy, but then before doing something more invasive like an injection or a surgical revision or something like that. So, it's safe, it's non-invasive, it could be a really good option before escalating to procedural interventions.